John Hammarlund, Medicaid and Medicare are kind of at ground zero of this demographic time bomb of potentially skyrocketing healthcare costs for the country going forward over the next 20, 30 years. I'm wondering about your perspective on the potential for healthcare informatics and electronic health records to help us muffle that bomb?
Ride the wave of the gray tsunami. Well, actually, I want to thank Ron for bringing up the case of his mother, because actually that's a perfect argument for why we really, why Medicare aspires to have electronic health records for every one of our millions and millions of beneficiaries. It's not just that it makes good clinical sense, which of course it does, but it's also because it empowers consumers to take charge of their own health care and also allows them to make better decisions about the quality and the value of health care they're getting. What Medicare has found, and I think Ron alluded to this, is that there are not a lot of electronic health records in small to medium-sized physician practices across the country. And when you think about it, there really isn't necessarily a good business case for a small practice to make that capital investment for that technology. But we're trying to incentivize providers to go ahead and to purchase that technology and to implement it. And we're doing it through a demonstration project. We often, in Medicare, test the waters before we try to do something nationwide, because we are the proverbial tail that wags the dog in some cases. So we're testing it in 12 communities around the country, where we are providing incentives to small physician practices, about 3 to 5 physicians in a group, to purchase the electronic health record technology and then use it to report on certain quality measures that we then can use to determine the quality of care. So we're not actually helping them with the capital investment of the EHR. What we are doing is providing them with bonus payments for reporting on quality data using EHR. We're hoping that catches on in these 12 communities and that we can ultimately go nationwide.